BA.2, another type of Omicron. No one is really surprised.
As long as the virus continues to multiply, new mutation will pop. Guaranteed. That is the lifestyle of the virus.
But this one is a subvariant. So what does that mean? The regular Omicron we've been dealing with is BA.1.
You can kind of think of them as sisters in a family, that they're related to each other. They have a common parent that they both were derived from, but they're slightly different from each other.
BA.2 has different mutations, and experts say we don't yet know enough about it. It's picking up speed in places like the UK, India, and Denmark, where it's the most dominant strain.
We've detected it since November.
Canada's top doctor says more than 100 cases have been identified here, and public health is monitoring closely.
International data suggests that it could potentially have an increased advantage on spread, but there doesn't seem to be any specific increase in hospitalizations or the severe outcomes.
It may be more subtle, but it needs to be watched, it needs to be studied.
The subvariant has picked up the nickname stealth Omicron, which this virologist calls misleading.
Calling it the stealth variant implies that it somehow acquired sneaky superpowers that it doesn't have.
If you have BA.2, a PCR test will still tell you you're COVID positive. It's just not able to detect the specific subvariant. Sequencing is needed for that.
For most people, though, I don't think they really care which particular sublineage of the Omicron variant they're infected with, because it doesn't really change what they need to be doing next.
At Friday's briefing, Dr. Tam stressed that while we may have seen the peak of this wave across the country, coming down the other side still means many infections, and BA.2 could be part of that descent. Abigail Bimman, Global News, Ottawa.